The legacy of HIPAA. Thesis: what rights do patients have under HIPAA, and what are the responsibilities of the healthcare provider to uphold the law? What is HIPAA? In 1996, a law was passed in the United States that will forever change the way health information is protected. This law, known as the Health Insurance Portability and Accountability Act, or HIPAA, was a response to growing concerns about privacy and security in healthcare. HIPAA established federal standards designed to protect sensitive health information. At its core, HIPAA ensures that the patient's personal health data is not disclosed without their consent. The Department of Health and Human Services issued the HIPAA Privacy Rule to enforce these standards, guarding against unauthorized access to protected health information, or PHI, by covered entities such as healthcare providers, health plans, and insurers. The HIPAA rules are built upon three foundational components: the Privacy Rule, the Security Rule, and the Breach Notification Rule. The Privacy Rule serves as the bedrock of HIPAA. It sets national standards for the proper uses and disclosures of protected health information. The goal: to ensure that only authorized individuals, healthcare providers, insurance companies, and patients themselves can access this sensitive data. Next, the Security Rule specifies how to secure health information when it is maintained or transmitted electronically. This was critical as the healthcare system increasingly relied on digital platforms to manage patient data. The Security Rule includes guidelines to protect electronic personal health information from being accessed or compromised through hacking, theft, or accidental loss. This rule mandates encryption, secure login protocols, and audit controls. Finally, the Breach Notification Rule ensures that when individuals are notified of their health information is exposed or compromised, healthcare entities are required to alert affected individuals and authorities in a timely manner. Origins of HIPAA. Our journey into the history of HIPAA begins in 1992. The Bill Clinton administration came with the promise of sweeping changes, especially with healthcare reform. In 1993, a year after Clinton's election, the Health Security Act was introduced to Congress. Backed by the president himself, this bill promised universal health care coverage for all Americans and the protection of consumer choice. However, the Health Security Act faced opposition, and the Clinton-backed bill was shelved. Democrats proposed their own versions of health care reform. This idea gave birth to the Health Insurance Portability and Accountability Act, known simply as HIPAA. The goal of HIPAA was to improve the portability and accountability of health insurance coverage. The law introduced measures to ensure that individuals could maintain health coverage between jobs, protecting people with pre-existing conditions. In 1999, the Department of Health and Human Services published the first proposed HIPAA privacy rule. It wasn't until 2002 that the HIPAA privacy rule was officially published. This rule defined protected health information, establishing clear guidelines for how patient data could be used, disclosed, and protected. By April 14, 2003, it became a compliance requirement for healthcare organizations across the country. But even as the privacy rule took shape, work on the HIPAA security rule was just beginning. Proposed in 1998, it wouldn't be finalized until February 2003. This rule focused on the subset of protected health information, electronic PHI, and set forth standards for how it should be safeguarded. By April 21, 2005, compliance with the HIPAA security rule became mandatory. The privacy rule and the security rule marked a turning point in how healthcare organizations handled patient information. Rights you have. Under HIPAA, patients can access their medical records, request corrections, and control who has permission to view or share their information. Patients also have the right to request a report showing when and why their health information was shared, and can even ask for restrictions on how their data is used. What is protected under HIPAA? It's your information your healthcare providers record about you from the moment you walk into the doctor's office to the conversations your doctor has with nurses, specialists, or other healthcare providers about your treatment. It's also the information in your health insurance system and your billing details at your clinic. Most of the personal health information that you share with providers and insurers is protected by HIPAA. Under HIPAA, you have important rights when it comes to your health information. You can ask to see and get a copy of your health records. You can request corrections be made if something is wrong. You must receive a notice explaining how your health information may be used or shared. And you can decide whether to give permission for your health information to be shared for certain purposes, like marketing. In the case of a breach, the HIPAA Breach Notification Rule gives you the right to be notified if your health information is accessed, used, or disclosed without authorization. You will be told how the breach happened, what information was exposed, and what steps you should take to protect yourself. Covered entities are required to act swiftly, investigating the breach, mitigating harm, and making sure it doesn't happen again. They must also provide contact information, including a toll-free number so that you can ask further questions or get further help. These rules apply. Responsibilities. Under HIPAA, a strict set of rules govern how that information is handled. But who exactly must follow these rules? First, let's talk about covered entities. These organizations and individuals who are responsible for ensuring your health information is protected. Healthcare providers, such as doctors and nurses, are covered entities. If they electronically transmit health information for tasks like claims, eligibility checks, or authorization requests, they are held accountable under HIPAA. Health plans, including insurers for dental, health, and vision, Medicare, Medicaid, and employer-sponsored group plans, are also covered entities. They handle sensitive health information every day, from processing claims to managing patient coverage. And then there are business associates, entities that provide services on the behalf of covered entities, like claims processing, billing, or data analysis. They too have obligations under HIPAA. These business associates are required to sign a business associate agreement, ensuring that they comply with HIPAA safeguards to protect your information. Business associates come in all shapes and sizes, from companies handling billing and payment to consultants, attorneys, and data management firms. But what happens if a breach occurs? Even when violations happen by accident, covered entities and business associates must have measures in place to minimize and prevent such breaches. If an accidental violation happens, the circumstances are reviewed and an investigation follows to determine the appropriate response. It is not just companies that must comply with HIPAA. The workforce, including employees, volunteers, interns, and contractors, must follow these rules as well. Everyone involved in the handling of health information, regardless of their role, is bound by HIPAA standards. The HIPAA privacy rule allows for the use and disclosure of protected health information for specific purposes like treatment, payment, healthcare operations, and even public interest activities such as public health and law enforcement. But no one can freely share your information without proper safeguards in place. The HIPAA security rule goes a step further, ensuring the confidentiality, integrity, and availability of electronic protected health information. From encryption to access controls, healthcare organizations must protect electronic healthcare information from unauthorized access or threats. Violation of HIPAA can lead to serious consequences, with civil and criminal penalties enforced by the U.S. Department of Health and Human Services. Healthcare organizations must not only have safeguards in place, but also continuously assess potential risks, ensuring that they comply with HIPAA regulations every step of the way. Modern HIPAA. HIPAA's regulations, last updated in 2013, fail to account for new forms of health data collection, such as through health apps and websites, leaving Americans vulnerable to data breaches. The current covered entities definition is too narrow and does not encompass all forms of health data collection, so the Department of Health and Human Services needs to revise HIPAA to monitor all health data from the point of collection. I examine the rights granted to patients under HIPAA and the responsibilities of healthcare providers to ensure that the law is upheld. Patients have specific rights under HIPAA, including the ability to access and request corrections to their health records, control sharing of their information, and be notified if their data is breached. Healthcare providers and associated entities are referred to as covered entities and are obligated by law to follow HIPAA rules, safeguarding patient information and reporting breaches if they occur. This includes compliance by health insurers, providers, and business associates.